Good day, everyone. We are here to present our assigned project entitled CARE Child Protection National Database and Technical Support. Together with our team, led by Samina Thao, Rajan, and myself, Junelle, we present our proposed AI-powered child protection system, which is designed to detect risk early and improve collaboration between agencies. Our goal is simple but crucial. It is to protect children before harm occurs using technology as a proactive tool. Currently, child protection faces four key challenges. The first problem is scattered data sources. Information is siloed between hospitals, welfare agencies, and schools. This refers to the huge amount of information stored in different places or sources, which makes it difficult to create a plan where and how to start addressing these child abuse or neglect reports. Second problem is the absence of predictive tools. There is no AI system to identify high risk children before harm happens. And currently, child protection systems are reactive, meaning they only respond after a child has been harmed. There is no predictive tools or AI powered tool that can analyze data that flags children who are at risk of abuse or neglect before it happens. Third problem is poor interagency collaboration. Agencies lack a unified platform for real time updates, which also means there is a lack of communication and coordination between groups that are responsible for the child's well being, especially without a shared platform, which may delay the intervention. Lastly, the inconsistent data standards. Different formats for allegations and for perpetrator types make tracking difficult. Our solution addresses all of this.
Hello everyone, my name is Thao and I will continue the presentations. Our system consists of five components that together ensure security, usability, and intelligence insights. The first one is UI or user interface. This is what user interacts with by dashboard that adapt to the user access level while anonymizing sensitive data for privacy. The second is application layers, which manage queue authentications and authorizations so that every access request is properly verified. The next one is AI and analytic engines. This is the range of the system using natural language processing to extract important detail, predict risk, and generate alerts in real time. The next one is data repositories. We store all information in secure SQL or no SQL database. It's inside this and fully compliant with privacy regulations. And the last but not least is the admin consoles, which administrators to monitor system activity, manage alerts, and review performance metrics. Next, let's walk through how our system works step by step. Step one is user login. First, a user log in securely through our website. The system immediately checks their roles and customize the dashboard to match their access level. Step two is data access by user roles. For general users that have no access to individual child profiles or specific case detail, instead they see anonymized visual summary, such as the trend charts. They can see how the trend charts show the report frequencies over time. And for the bar charts, it's some summarize data by gender, regions, or type of abuse. All of this data in anonymized and no single case can ever be identified. For school and hospital accounts, they can only see case linked to their own institutions because this ensures both privacy and organization data separations. And for admin accounts, this will have full access to the entire system. They can view and manage SQL data like users' account, access logs, and role permissions, as well as no SQL data, including child profile, incident reports, inventions history, analysis, and system logs. Admin are also responsible for overseas operations, tests, and alerts as a national level. The next step is report submissions. One log is in, users can submit report in two-way by answer AI-generated questions tailored to the case, or by uploading documents such as school report or PDFs. The next step is NLP processes the input. When a report is submitted, our national language processing ensures automatically test over access key information such as personal detail, behavior size, incidence frequencies, and emotional indicators, and convert key nodes into structured data ready for analysis. Step 5 is AI analysis, bridge level. Next, the AI engines combine this new data with any existing historical record for the child. It's look for patients of neglect or abuse, consider past interventions, and assess risk factors based on the child reasons, school or household. If the system detects a higher or urgent risk, it immediately triggers an alert to relevant care workers or, or administrators. And the final, the data is stored and monitored. Finally, on-scale data is securely stored in our centralized database. Every access is logged for transparencies and the system continue monitor their case over time, tracking progress and identifying any new warning signs.
Hello everyone, I will discuss the identified risk and mitigation strategies. We have categorized the risk into three main areas: technology, resource, and scheduling. For each, we assessed the probability and impact on a scale of 1 to 10 and calculated the resulting risk score by multiplying these two values. First, under technology, we identified that the AI model accuracy may be insufficient when working with limited data. This risk had a probability of 7 and an impact of 9, giving us a high risk score of 63. To mitigate this, we plan to use synthetic historical data for model training and implement a manual rule-based fallback. With this mitigation in place, we expect the risk to reduce significantly to the score of 30. Next, under resource, we anticipate challenges in obtaining reliable data from government systems. This has a probability of 6 and a high impact of 10, resulting in a high risk score of 60. To address this, we will use simulated datasets for the initial prototype and prioritize building strong partnerships with data providers early in the process. This brings the mitigation risk down to the 25. Lastly, for scheduling, integration of complex systems could cause delays. We rated this risk with a probability of 5 and an impact of 8, giving a total risk score of 40. Our mitigation strategy here is to modelize the system architecture and start early with the core functionally. This reduces the risk score of 20. Overall, the mitigation plan helps us significantly to reduce the potential negative impact of this risk and give us a clearer path to success. Thank you.
Hello, I'm Samina Gurung, and I'm going to talk about the completion plan and the conclusion. To complete our system, we will develop a fully functional AI-powered website, build user-friendly interface for different stakeholders, integrate AI and NLP models into the front end, implement secure role-based login systems, add real-time data visualization with charts and alerts, deliver a prototype for testing by real users. Thank you. To conclude with this presentation, our AI child protection system can transform early detection and innovation by integrating data, enhancing collaboration, and providing actionable insight. We can help protect vulnerable children before harm occurs. Our prototype proves the concept works, and our next step focuses on testing and continuous AI improvement. Thank you. Bye.